See here, there's that lump popped up right there. And then again here, here's the acromion, there's the clavicle sticking up like that. Same thing right there. I mean, that's pretty easy to spot. Okay? You really almost don't even need any special tests. You just look at it and you say, oh, I fell down on my shoulder like that. What's that bump there? Oh, you got an AC separation. Okay?
It's gotta hurt.
Well, with any kind of ligament tear, if it's completely torn, it doesn't hurt anymore. Okay? It's only going to hurt if there's still some fibers connected, which in most cases, hopefully, you're not going to be completely separated. And a lot of times, you don't really do anything about it, unless someone's like a professional athlete or probably competitive sports and things like that. Otherwise, you're usually just going to leave it alone. There's not really any muscles you can strengthen that go across that joint. So you're basically just going to have a lump on the shoulder. So, okay, so now that's talking about the distal end of the clavicle. What joint's at the proximal end of the clavicle? Sternoclavicular, right? So can you have similar things happen there? Right. So what kind of trauma would cause something like that? You know, something that's pushing here. You know, impact into the shoulder, and maybe it's going to give way here. Anytime you have traumatic injuries, it's going to give loose somewhere. Depending on the vectors of force, it may happen here, it may happen there, it could happen in both places. So also you could have a direct blow here. So something that's pushing this up that way, or indirect impacts in here that's forcing, the line of force is going to go through the clavicle and it's going to break loose here. So then you get a check here, and if you compare one side to the other, you'll see that the clavicle's popped up on one side. And then typical thing, they're going to have tenderness, swelling, palpation on that area. And then again, as far as a test, we'll have another spring type test. If you're pushing down on this and you feel the clavicle moving up and down, that's not a good sign. Okay, so now we'll talk about labrum tears. So there's basically going to be two different kinds of labrum tears. There's going to be one that's called Bankart, and another one's called slap. Okay? The Bankart tear is one that occurs with anterior-inferior dislocation. So if we're looking here onto the left shoulder, do it this way. Lost his head. Okay. All right, where was it? All right. So if we're looking at the right shoulder, we're going to be talking about the 7 o'clock position right here. Okay. So this humerus is going to move like that, but that's where the labrum is going to get nicked right there. Okay. If this was on the other side, then it would be the, 5 o'clock position. Okay? You don't want to think about it in terms of clock, just think about it as anterior-inferior. Okay? Anterior-inferior dislocation is going to tear the anterior-inferior part of the labrum. So this is where it's going to tear it right here. Okay? Posterior-superior, that's going to tear it up here, or across the top right there.
You gotta worry about that if you're putting it back in.
Yeah. I'll tell you a story about shoulder dislocations in a minute after we get through a little bit more of this. So it's basically kind of fraying and tearing some of the parts of the labrum here. Right? So it can either injure the actual labrum itself, or it can just tear it off where it attaches. So then in their history, they're going to have, say, something happen like this, their shoulder got pulled like that, or they got pushed from behind and pushing it down that way. Same thing as an anterior-inferior dislocation. There's going to be tenderness deep in the joint, and then there's going to be a special test that's called the clunk test. So basically what you're doing is you're popping that humeral head out, and it's going to clunk across that labral tear. All right, then the other one's called SLAP. And SLAP stands for superior labrum anterior posterior. So then the mechanism of injury for that is the same thing as a posterior superior dislocation. So it's going to be the foosh, right? So either a foosh like this or something that's pushing the humeral head back and out, like that, right? Let's see if it's going to survive here. So the humerus is forced into I think that needs to be changed in the notes. It says abduction like this. It should actually be adduction, adduction. Okay, so change that in the notes. Okay. On page 62, kind of right in the middle where it says MOI foosh, similar to posterior glenoid GH dislocation, humerus is forced into adduction like this. That's what's happening is that this biceps, one of the heads of the biceps attaches up onto here. So you're forcing the humerus like that, and then it's popping out like that. Okay? So it's pulling it off from the top. Or it can happen with the posterior superior dislocation. So it's either pushed out like that, or just suddenly forced like that, and then it just breaks loose at the top right there. So the biceps tendon pulls away from the labrum and tears part of the labrum off with it. So basically the pathology is that it's, so here that shows it right there. So this is forced that way, pulling this off right up here. Okay? And it's going to tear up in this area here. So they're going to complain where they have falling on an outstretched hand like that, or repetitive throwing injuries, or lifting a heavy object. So there's going to be tenderness deep inside the joint. I mean, you can't really palpate underneath here and get into the labrum, but they're going to complain of tenderness deep into the shoulder joint. And then there's a couple special tests. One we'll talk about with the O'Briens, where you're doing certain maneuvers like this, trying to elicit the popping in the labrum. So then what kind of injuries are you going to get tearing down here? So if you have a labrum tear down here, so this is looking into the right shoulder. Here's the acromion. There's the corticoid process, there's the scapula. So what kind of injury is going to affect that part right there? Is it going to be posterior superior or anterior inferior? Yeah, it's going to be this one, anterior inferior, because it's going to move down like that. And then the other one is going to injure it up here. That's going to be the foosh like that, or forced adduction. All right, so now just a little bit more on acute trauma. You can have rotator cuff injuries that can occur with acute trauma. You can have a sudden tearing of part of the rotator cuff muscles. Most of the time it's going to be more likely a repetitive injury.